Hi everyone. Our topic for this module, Module 3, has once again taken on a whole new meaning over the past year. In this module, we continue our conversation about our public health system through implementation and improvement. Our 3 case studies this week really highlight the different aspects of these concepts. Turning to Module 3 objectives, our first objective is that given the current status of health reform implementation, devise a report card for Affordable Care Act-related health reform efforts to date. This becomes extremely essential moving forward, especially given that our next module begins with advocacy. It is critical to understand what works well, so as a public health community, we can create effective advocacy efforts around these measures. We also need to understand what hasn't worked well for the same purpose. So as part of our additional resources, I've included information about the changes that this administration has been able to make to the ACA. These changes were twofold so far: expanding access to skimpier insurance and scrapping federal subsidies. Our next objective is that given a prevalent community health problem, disease, or condition, develop a strategy for designing, implementing, and evaluating an evidence-based intervention. So let's jump right into our first case study, the Affordable Care Act and health reform. But let's go back to President Obama's health reform principles. Looking at these 8 principles, which problems of the U.S. health system do these principles target? Let's actually start with some background information for you to consider before you respond to the ACA case study. These next slides are graphics of aspects of our public health infrastructure, something you've all captured really well in your tools in the first module. Regarding this finance piece, I just wanted to highlight that access is at the core of this payment piece of our infrastructure map. View these next 4 slides as a reminder of our overall public health infrastructure. Considering the place and space of intervention strategies and their effects. Many of you selected this public health impact pyramid as your infrastructure tool. Along with considering intervention strategies and their effects, we also must consider the burden of disease, as well as the function of incidence and prevalence, which you profoundly considered during this most recent prioritization process and tool development. Considering our U.S. input compared to our output, how do we make this model more effective? What provisions considered in the ACA have begun to make this model more efficient? Now keep these considerations in mind as we examine the healthcare system. We spend more than $3 trillion on healthcare, which is more than 17% of our GDP. Don't forget that only about 2%, and some years less, is spent on prevention. So 17% of our GDP is larger than the entire GDP of all other nations except Germany, Japan, and China, but is still a third of the size of China's GDP. So now review these next slides to begin to understand what in the world we're spending our healthcare dollars on. look at these actual causes of death. Is more health care the solution to these causes? Where do our advocacy efforts today in regard to upholding provisions of the ACA need to begin to intervene? What provisions in the ACA account for prevention? And at what levels of the ecological model? Our case study question asks you to choose one of the 7 scenarios listed in the case study and describe how various provisions of the ACA affected that family or individual. Then, describe how the impacts on this family or individual contribute to overall goals of the ACA. As you respond, consider what's the most important issue facing our U.S. healthcare system today. Is it cost? Is it now, again, access? Quality? Or what else? Now let's go back to the key elements of the ACA. The health insurance market reforms, the health insurance exchange, subsidies for premiums, which was most impacted by the most recent change, expansion of public programs, the individual mandate, the employer requirements and incentives, provisions for small employers, the delivery system reforms, and the shared responsibility for financing. Where's the biggest impact of the most recent changes? What's been preserved? And how can we improve all moving forward? Let's now turn to key public health components that we've maintained within the ACA. The ACA expanded access to over 30 million uninsured through multiple strategies. Clinical preventative services are included with first dollar coverage. The ACA established the Public Health and Prevention Fund, as well as loan repayment incentives for public health workers, and the ACA requires hospitals to assess community health needs, as we've focused on in these previous modules. Looking at the expanded coverage provided by the ACA, the uninsured rate dropped from 20% to 9%. I look forward to your analysis of these 7 scenarios presented in this case study. And now let's take a turn into public health implementation and evaluation. We'll start with a case study of an HIV/AIDS prevention and care intervention and evaluation effort in Thailand and Japan. Let these following questions guide your thinking for when you respond to this problem. Who are the key actors of this project? What's the nature of the project? What's going on in the project in each part of this case? What's the controversy in each part of this case? And then what problems are Ms. Tani and Ms. Moreno facing? And finally, let's return to the Gulf and our BP oil spill case study from the angle of intervention, implementation, and evaluation. You're to assume that you're part of the community health division of a local health department serving a coastal Louisiana community, and that you're planning an already piloted intervention that includes both individual and clinical support services, such as counseling, surveillance of certain outcomes, and that will also monitor and promote community cohesiveness and well-being through surveys and other activities. The conferencing exercise question is therefore to identify 3 major challenges, maybe social, ethical, political, cultural, legal, or distributional factors to successful implementation of the project, and explain how these anticipated risks can be mitigated. You should consider strategies and approaches to address these considerations, including any needed to keep the community engaged during the 5-year period before any results will even be available from the intervention. On that note, I hope you enjoy exploring these topics and thinking about them more profoundly. And regarding the ACA and the conversation, I hope that we can all turn our frustration into advocacy, as we'll explore more in depth in the next module. Thank you.